Hello, everyone. I'm very happy to have a somewhat unusual expert with us today. She is a full fledged dentist, but is now into public health. Today, we have with us Dr. Prachi Sharda. Let's listen to her. Over to you, Doctor.
Hello, everyone. Thank you, Mrs. Mathur, for this opportunity to make myself understood and speak here today. I am Dr. Prachi Sharda, and I'm a dentist by training. But currently, I work in public health. I'm a public health professional. My current role is with the WHO, the World Health Organization. I am a consultant to the Ministry of Health on matters of mental health. Uh, Prior to this, I worked with Johnson and Johnson, which is a pharma industry. I worked with Janssen Pharmaceuticals, and prior to that, I was with the Government of Maharashtra as a state program manager for mental health. So, in short, I have sort of gone around a lot of places in healthcare, and that is what has always been my plan to say so that I wanted to see healthcare from a 360-degree point of view, where public health is the core of it. And I am on that journey right now, and I'm very happy that I have transitioned from being a dentist to a public health professional. So, so to say that I sort of knew from childhood that I would like to do something in public service and giving back to the community. And the seeds were early sown in by my parents, who both were teachers and first generation learners, and came from very humble backgrounds and really focused all their money and energy on our education to give us the best of education, and while not forgetting about giving back to the community. So even though we were not very well to do financially in the early years of my life, but my parents made sure that they were giving back whatever they could to the community. Both my parents were social workers, and my mother used to run an NGO. She was also a teacher with the BMC. She used to teach standard seventh Marathi medium school, and my father also was a teacher. So when I grew up, I knew that my parents wanted me, especially my mom wanted me to be a doctor because being a first generation learner, she had become a teacher, so she definitely wanted the next generation to go beyond that. And I really thought that this is something that I would like to do for her, even though my interest area did not lie particularly in science or in medical. I went ahead with the decision to take admission into dentistry because I knew that my mother wanted something of that sort. So I did it. The next 5 years after my 12th standard, I think were the most challenging years of my life. I got an admission into a rural village called Khed in Ratnagiri, which is around 250, 300 kilometers away from Mumbai. And I took that chance and I went to that hostel and I lived there. And that was the first time, rural life hit me. So to say, it really hit me coming from an urban background, um, and then going to a rural place and living in a hospital and meeting patients from different places in life, and people with very limited access to healthcare, people who did not have the financial capacity to pay for healthcare. This really struck me during my entire stay in the hostel and in my dental school. So when I passed out of dentistry, I started practicing on my own and in a clinic. And during the same period, I got in touch with a few friends, and I thought that I saw this scenario in a rural place. What is this urban scenario? So we came together and we started a small community based organization called Education for Equality, where we used to work with rag picker kids. And the kind of issues that they had was something I had never thought of. I mean, once a kid came to me crying and said that, nobody in my class wants to sit next to me. And they say that I stink. That's why they don't want to sit next to me. And it just I mean, I was so shocked listening to that. I had never thought that some kid would be in that situation. And the teacher had made him to sit on the floor because no kid wanted to sit next to him.
Mm.
So that is the kind of discrimination these kids, even today, face in schools, where everybody should be equal in front of the teacher as well. The teacher also should not have made the student sit on the ground. And so this kid stopped going to school for a long period. For a month or two, this kid did not go to school because felt very ashamed with the whole experience. And that's when I thought that the kids need a bit of support, not just in education, but in healthcare and also in all round development of theirs. So a few of my friends would conduct some medical camps there. We would have simple activities and weekend classes for the kids, along with English speaking. So for the next 1, 2 years, this continued. And while I was still practicing as a dentist, then I thought that I think it's time to get formal education in this field. And that is when I came across TIS and I joined the Tata Institute of Social Sciences, and I think that has been the most life-changing experience of my life. I mean, the way that place helped me look at the world. I mean, I always knew that inequalities existed. I always knew that we had to fight for it since my parents, from a very young age, had inculcated this into me. But studying it formally at TIS, meeting people from the remotest corners of India, meeting people from varied backgrounds, varied streams, just opened me up in a very different way. The kind of opportunities that this college gave. I mean, coming from a medical background where hierarchy is very, very set in stone. I mean,
Okay.
even if somebody is a year older than you, you have to call them sir and ma'am because they are your seniors and they are the ones who will eventually send patients to you, so you had to be like really nice to them. And then coming to TIS, where you were with your professor at first name basis, or you were just very openly sitting in your amphitheater or in the quadrangle and discussing varied topics across the social spectrum or political spectrum. So getting that kind of opportunity, I think, really instilled a lot of confidence in me. And that led me to so many finding out so many new things about myself. And I think during this course of this, the kind of exposure that the institute gave was through internships, right? So the first internship that I had was in a urban tribal setting, which is very unique to Bombay, honestly, where tribes have been living for a long time. But now because it is so close to Bombay, there is so much of urbanization and loss of their culture. So here in Borivali National Park in Bombay, there are inside around 10 kilometers inside the national park, there are a few tribal populations that live in Padas. So I was working with them and then with a few people in RA colony when was not yet cut down and it was a lush jungle, I think 4, 5 years ago. That is when I was working on menstrual hygiene with this woman. And it was such an interesting experience. And I did my research on menstrual hygiene, but what I realized there was no water in the area. There was, I mean, I was here to talk about menstrual hygiene, but people did not have water in their houses. And I mean, why would they even want to listen to me talking about menstrual
Right.
hygiene when they didn't have water to drink? So I at that point in time I felt that it's great to get into these niche areas and talk about them and research about them and make your profile stronger, but actually it is not helping the people on ground, it is only helping the researchers. So that shift of mind, that that entire understanding of that place came to me from this internship. And uh, it really opened my eyes to a very different place, to very different people, and a very different set of problems. Post this, I think my next internship was a field practicum with the government of Maharashtra, where I worked with the urban health department. And this internship as well was very, very interesting. This was about um, creating hospitals to be the first point of contact for domestic violence victims. So domestic violence is never really thought of as a healthcare area. And the whole point of this project, Dilasa, was to sort of make it a healthcare priority, because what was really discussed was, when a woman is battered, she will not go to the police station to write a
No.
complaint. She will first go to the hospital, right? And that becomes your first point of contact with the domestic violence victim. So why not train your doctors and nurses to identify these cases? So this is what Project Dilasa was about, and it was already running in some 5 hospitals, and they wanted to scale it up. So they wanted me to sort of evaluate and monitor it so that they could give it to another 11, 12 hospitals. So I worked with the BMC, I worked with the state of Maharashtra, and with the NGO that had started Dilasa as a pilot project. It's called Sehat. So during that experience, I met a lot of people. I understood that domestic violence is at such a large scale in India, and the victims will never come and tell you that, they have been through this experience. They'll come and tell you, I fell down from stairs, I got stuck somewhere and I stubbed my toe. But a doctor can always identify what these signs of domestic violence are. So I think that was a project I really worked on passionately, and I wrote a nice report. And now the LASA has been scaled to more hospitals by BMC. So it was really nice to go through all those 3 months, and during that time, I understood what research is actually. How you actually collect data, how you connect with people, what are primary interviews. All of that understanding came from this beautiful project. So I think it will always remain a highlight in my life.
Okay.
Apart from this, uh, as a thesis topic in this itself, I was working on self-medication in transgender population.
Okay.
And through this thesis topic, I had a very good guide person, a very good professor to guide me, Dr. Nilesh Gowde. Along with him, we worked around many trans people, and few trans men, few trans women, and a few from the Hijra community, because all of them had different perspectives about medication. And when I was working on my thesis, I think it was one of the most life-changing experiences to go inside and live and talk and eat with the Hijra community in India, and understand what their thought process is, where they're coming from, and what they want to achieve, and how non-accessible healthcare is to them. At every point of access, there are so many stop signs for them. And when I wrote about this in my thesis, I realized that there's a very big need to have a good healthcare policy for transgender individuals, because there are problems like a trans woman does not want to be admitted into a man's ward, but
Yeah.
the other women are again not going to be accepting of that person. So where do they go? So they're just thrown in between two wards, like where there is some dustbin, or there is nobody, there's some blank space. They just put their bed over there, and not really in any ward. And I think because of this, when I was interviewing people, a lot of them told me how many people they had lost to medical negligence. And usually, when we talk about researches on trans population, what happens is everybody is thinking from a hormone perspective, what kind of hormonal injections are they taking, or they're thinking from a HIV perspective. But understanding why people are self-medicating today, I think that also really shaped my perspective about different people in the world and the different healthcare needs. And since by then I had decided that, I would one day like to, be a policy maker, or I would like to work in policy. Uh, I realized that, while making policy, you have to think about so many people at different spectrums, not just people who are in the limelight or in the mainstream, or just the middle class where you come from. But there are so many accessibility issues for so many different populations. Beyond that, I think once this got over, very very suddenly, because of a pandemic that happened, and I was just straight away into a government setup. I got my first job at the National Health Mission of Maharashtra, where I was posted as a state program manager for mental health. So mental health had always been a very an issue which is very close to my heart since uh, I have seen my loved ones suffering from it and have also experienced some major loss in life because of mental health issues. So it was always so close to my heart. And in my second semester, I took my subject as special subject as mental health. And that's how I moved on to become the state program manager for National Health Mission. And here I landed up in the middle of the pandemic when everything was in chaos. I think I joined somewhere around April when, the lockdown had just begun. And within 30 days, I got a call to join. And I had to go every day to the office since so health offices were all open, everything else was shut. And now I was a government servant, so I had to go every day. There was not really many avenues for transportation or for stay. And every day that I went to government office, our office was inside a COVID hospital. So there was always this fear of exposing my mom at home, who was a hypertensive patient, to COVID. So I think that was a really fiery, very, very feared situation. I mean, I was very, very scared when that happened, that because of my probably job, my mother has to suffer. And when everybody got out of this, everybody wanted to get into corporate jobs, and a lot of people took up corporate jobs. But I just waited and waited, and I waited for the government, which was paying very low. To be very honest, it was just 25,000 a month in a city like Mumbai. And after doing my BDS and post that, after doing my masters from a prestigious university in India, and that was the state still. So I think it was just my mother who supported me at that point in time, and she said that no matter what, you do what you're passionate about. And this time around, she really understood me. After I had done the BDS thing, she gave me a chance to do follow my own path. So I think that support meant a lot to me, and also the passion I had towards public health. I think we don't give enough credit to our passions, but I think what helped me survive through this field, which is a very new and budding field in India today, is my passion. And because of that, only I could, survive in an environment of the government during a pandemic at 25,000 rupees. So I think that experience, though, now when I think about it, I feel like that was the time when I got the most exposure in my life. It was the it was peak of COVID, and everybody was scared of the disease, and also on the other hand, they were scared of not of going out. A lot of people started having OCDs during that time. A lot of people slipped into depression. This was happening to the common masses, but people who were working with me, the healthcare workers, the doctors who were in PPE suits for 6 hours, 8 hours a day, who could not even, go out to pee, like such a basic thing. They could not even drink water during that time. And what would be their mental health? And during this time, what had happened is all the senior doctors, because of their age, were not really there the whole time because, COVID was catching up with the older population. So during this time, entirely interns and the first years, the first year PG students were handling the wards. And these were young people suddenly in the middle of a tragedy and, not being able to do even the basic of their things. And, that time it really struck me that there needs to be something to be done for their mental health if we want to boost our workforce. If this is going to continue for the next 2 years, which it did, there needed to be something which was bang on for the mental health. So this is the time when I proposed the Manoswasthya series in Maharashtra, which were expert lectures every Friday for the healthcare workforce. And this involved everybody, right from the ASHAs to the multipurpose workers to the surgeons in hospitals. And we collected a bunch of experts across many months. This continued for a year, 1.5 year during COVID, and it reached around 10 lakh healthcare workers. I mean, the series was a huge hit, and my phone just would not stop ringing, and they
Right.
were all like, this is so great, this is so great, we want to share it, share us the links, make shorts out of it, we want to share the tips with our friends or something of that sort. And already at the state, I was sort of coordinating with the districts. So there were 33, 34 districts in Maharashtra, and there were 6 people in each district for mental health. So keeping the josh up of the health force was very important, because these people were visiting migrant townies, because Maharashtra had this huge migrant issue where, suddenly during COVID, one day there was like Bharat Bandh and nobody could go anywhere to anywhere. The trains were not working, and the migrant population which was stuck in Maharashtra and in Bombay did not have work, did not have the money, and they could not go back to their villages. So they just started walking from Maharashtra towards their villages, whether it was down south or whether it was in UP or Bihar or Karnataka, Andhra Pradesh, and they could not go too far. So eventually the government made some chownis, and the Supreme Court ordered for mental health counseling in these chownis. So the team was going to do these counselings every day. And during this time, I also realized that, during COVID, there needs to be a different guideline for this entire thing to run. Because without it, there was just going to be absolute chaos. Nobody knows what is supposed to be done, first of all, where it is supposed to be done, how it is systematically supposed to be done. And the most important thing, how are we supposed to collect that data back at the state and then to be sent to the center? So during this time, I was able to be a support and a part of developing the mental health guidelines during COVID for Maharashtra. And I feel that was a big confidence boost for me, because I always wanted to do something in policy, and here I got
Yeah.
this little chance, to do something so important during a pandemic. So that was I think one of my best experiences, where I got to work with all the experts, talk to them, listen to them, understand, how a policy is made, how things are thought around, what this 360-degree thinking actually is. And I think post that, once COVID started to sort of get a little better, very soon there was a proposal for a women's mental hospital in a remote city called Jalna. And then I got to work on this beautiful project of creating a women's mental hospital in a remote village. And when we were supposed to do the inauguration of this, I also got a chance to go on a tour with the health minister of Maharashtra, across districts, to understand the mental health over there, to sort of supervise all the clinics and hospitals and sub-district hospitals. And it just took me back to my dentistry days, where I used to sit in the sub-district hospitals and wait for patients to come. And, I think being a dentist also, what happens is a lot of patients come to you time and again. They become your long-term patients, right? And I think they feel slightly closer to you to share their things, their family
Mhm.
issues, because they're constantly visiting you. And through those sub-district hospital visits and my hospital patients, I realized that, mental health issues were so heavy. I mean, every person was facing some or the other level of mental health issue, especially because, our lives have changed so much in the last 50 years. But have we thought about if our brains have really caught up to that?
Mhm.
Our brains are still growing at the same level that they were around 100 years ago. And now suddenly this entire onslaught of social media, of so much of work stress, of not being able to spend time with your loved ones, not having a community, or more so in urban areas, having that individualistic kind of lifestyle, again, leading to loneliness. This is what I realized when I practiced in both. When I was in rural, there were more of family issues, and people were not happy with the relationships between the family. But in urban areas, people were longing for those connects and they wanted to go back home. So this was like a very different, two different ends of the spectrum for people and their relationships. And that's when I realized that, I really want to work in mental health. So this entire experience, right from the sub-district hospital to coming and working in TIS and talking to women and transgenders and everybody. And then I thought, no, I think mental health is definitely my calling. And since I had already spent a year in mental health, it became more fortified that I was doing very well and I can take this ahead. So after my government experience, I got a chance to work with Janssen Pharmaceuticals, which was a very big shift in my career and the kind of culture I was in. So I was here in the middle of this chaos. COVID is going on. No one knows what is happening at the state. No one knows what is to be done. We are all trying to figure out, making guidelines, all of that. There's no not really very organized kind of stuff is happening. And then I suddenly go onto a corporate where everything is so organized, where people are like एकदम tip top, to be said in government language. Everybody in my office say corporate वाले तो बहुत tip top होते हैं. And I enter this office with a new national role. I am like this field market access manager for Janssen Pharmaceuticals, which is basically creating access for medicines in government hospitals. And here again, I got to work on one of my favorite areas, mental health, and more so in schizophrenia. And that's when I realized the impact of severe mental disorders. And we often talk about depression, we often talk about anxiety, but how many of us really want to, address schizophrenia, or, live next to a person with schizophrenia, or, if somebody around us has schizophrenia, do we live in the community with them? So that really opened up my mind. When I went to many, many states, I had a lot of travel involved in this role. So I traveled across India in various hospitals. I traveled to army hospitals. I traveled to government hospitals. I traveled to corporate hospitals, to
Mhm.
clinics, to private practitioners, to sort of understand what was needed right now in mental health, and what how this severe mental illness is actually such a big issue that nobody really is talking about. So if I talk about the prevalence of mental illness is 1 in 7 people in India today, and this is a 2016 statistic of the National Mental Health Survey. We don't have a recent statistic, but between 1 in 7 to 1 in 10 people today, suffer from a mental illness. But at the same time, the treatment gap, which is how many people are able to get the treatment, is 1 out of 10 people, 1 out of 10 people. So the treatment gap is almost 85 to 95%, and which is, I feel like, I'm not very sure, but it seems like the biggest treatment gap for any other disease, where we have the accessibility, where we have treatment centers, but people are not willing to go. This is where the stigma component came in. And why are people not accessing these facilities? That was the big question. So that was the point when I remembered what my esteemed professor, Dr. Sundaraman, told us once in our class. And he said that, if you are working at a private hospital, you are worried about every patient that walks in inside your hospital. You are supposed to take care of all the aspects that patient is going through, right? And their caregivers, everything. But when you are working at a public role, you are not only supposed to think about the people walking inside of the hospital, but also why are other people who are suffering not walking inside the hospital?
Mhm.
So,
Okay.
in that whole puzzle, solving this very important piece for mental health is something that really caught my attention. And I thought that, here is this big gap in public health system, and this is exactly where I want to work. And once I started working on schizophrenia and understanding it from all the different levels, like I used to go and meet also patients at very, very high level corporate hospitals. I used to meet the psychiatrists. I would understand what they want. And at the same time, I would meet patients from government hospitals where they said that, they didn't want to come for the next appointment because they were taking their son or daughter to some Baba, or they had found some great person back in their village who cured people with such illnesses. And I saw the doctors struggling to, explain these people that no, it is very important that you continue this treatment, or if there's a gap in this treatment, there will be a relapse for the patient, which is even worse. So one very important thing is that mental illnesses do not have a complete cure yet. They usually are lifestyle. By lifestyle, you have to do it, or by taking medicines.
Mhm.
So that cure for mental illness is not yet here. That the cure for schizophrenia or the cure for bipolar is not yet here. So that part, a lot of people are not very happy with, and they feel like, if I take them to the squad, probably, it's just kala jadoo done with my son or my daughter, and mainly changing that mindset is the most important thing today in mental health. So with all of that experience in Johnson and Johnson and my previous job, I applied to WHO because I felt like public health was my calling, and remaining in pharma is something that is not uh, working out for me really. But when I got into WHO, I immediately realized what my calling was. So even though I had to take a pay cut and go to WHO from a fat salary check in pharma, I took that opportunity and I shifted from Bombay to Delhi. I am basically from Bombay, but now I live in Delhi because I work with the Ministry of Health as a consultant. So in my current job, I feel like everything that I have learned up to date, till date, is coming together and I'm able to use it. All the perspectives that I've collected from everywhere, I'm able to use it today. And, now today I have that opportunity of actually revamping or redesigning the mental health program of India. I am a small part of redesigning the entire program. So, now I get to actually implement or at least write it into a programmatic form, all those things that I have been planning for mental health for so many years. And one of the most important thing, and currently the buzzword, in mental health, is deinstitutionalization.
Yeah.
So, so when I first heard about this word, I was a little taken aback. And I could not really understand, why do they want to like break the psychiatric hospitals and bring all the patients into community where, there might be stigma, or they might not be treated very well, or there's a chance that they might become homeless. But now, when I read so many documents and, I attend so many seminars, I realize that just giving treatment to a person is not enough. It is very important that you give them rights-based treatment, which is like very low on priority when we have to deal with mental health patients, right? People with mental illness. So in 2017, India had a Mental Health Care Act. It launched the Mental Health Care Act, and now it is being implemented across all the states. So I think we are definitely moving towards a right-based approach, but what is also important is having a community-based approach for the patients, because they are patients, right? There is no health without mental health. And if somebody wants to get a mental health treatment, why does that patient have to go to a very different hospital somewhere away from the city, somewhere in a peripheral location, and they have to stay away from their family, and all of those things that come along with rehab, which is one of the most important things in mental health. So so now the focus has really shifted to having peer support groups at community level, having a community based approach to mental health, having that stigma component removed from mental health. And I think I have a really great hope for mental health in the coming years, since I think people have realized how important it is, especially after the pandemic, when I think most of us faced some or the other level of mental health issue. Uh, Whether it was depression, or it was anxiety, or whether it was OCD, or just pure loneliness of
Mm-hmm.
sitting inside a room all alone, or people who had been quarantined, just living alone by yourself for 14 days. It's not a joke, really. So
No.
even that has had such deep mental health impacts. And now I think right now I am sitting in Delhi and it is like very, very hot here. We have a heat wave coming along. And now I realize that how climate change is affecting my mental health. I mean, I don't feel like going out. It really is. I mean, very recently, ILO released a report about how climate change was affecting the laborers' mental health, who are working on the roads, who are rickshaw drivers, who are e-cart pullers. How are they working in a 52-degree of heat, in and out, dry, scorching heat the whole day? it is obviously affecting their physical health, but at some level, it is also affecting their mental health. And I
Mm-hmm.
think even if it is a small part of it, it really needs to be acknowledged. So, now I have that chance to actually think about all of these things, put it, in a place, or actually word it. So I'm really, really thankful for this opportunity that I have got in my life with WHO. And it feels like now is the time where I can actually, implement so many years of my thought process. And I think it's going to be a very good time for mental health in the coming years. I'm really hopeful with the kind of awareness creation that is happening. Just one thing I feel like, you know how when HIV/AIDS came in India and people did not know anything about HIV, and everybody was worried, and everybody was saying that if you touch somebody with HIV you will get it, or if you kiss somebody with HIV you will get it. And you know what broke this? A major massive awareness campaign from the government,
Right.
where everybody with the tagline was "ये बीमारी छूने से नहीं फैलती," which means that this disease does not spread by touching. And
Mm-hmm.
I think that really helped, you know, at least a little bit in opening people's mind. Or say our polio campaign, which was done by Mr. Amitabh Bachchan, and it said "चार बूंद दो बूंद जिंदगी के." And it was so well taken that we almost eradicated polio in 2012. So, that kind of campaign is what is necessary for India right now, is what I feel, because we are really at the awareness stage. Even if we have treatment centers, why are people not coming to these treatment centers? Of course, we have a large footfall, we have a large number of patients in our psychiatric hospitals, but still, we have a treatment gap of 90% almost. So,
Mm-hmm.
I think that is what really needs to be addressed, this awareness, this stigma reduction, and then eventually coming down to community mental health.
Mm-hmm.
uh, so that is what I think was from my end about my journey and my career and my interest in mental health. Um,
Well,
yeah, and I would like to, yes,
thank
yes,
you
please.
so much. You have so much energy, enthusiasm, passion, dedication, and is going to lead to good results. That's what I feel, that it's going to lead to good results. Uh, you have found your space now. It was a bit
Yeah,
of
it
a
seems like.
journey to find the space, but it takes time for many of us, but you have found it. And I think it is a hidden disease in India, not obviously acknowledged and not treated. And as you said, all the treatments aren't in, but we have to begin. We have to begin. And there is urban areas are increasingly going to feel mental health issues. There are young people in colleges, in good colleges, who are suffering mental health issues. I talk to them, I listen to them, and they don't say it, but there is tension. There is tension. The competition brings tension, and failure brings even more tension. And how are they going to deal with all this? Because life is so competitive, and if you don't make it, you are in trouble. So, how are you going to do all this? I hope you and your colleagues will work on it, and you will produce something that will help. As you said, the differences in the urban issues and the rural issues, but we there were some safety features in the rural areas in some way, but there are no safety net. There's no safety net in the urban areas, especially in the big cities. There's no safety net, right? It falls apart because as you said, you're lonely. Now, I don't, want to say more, but I'm just thankful listening to you. I've learned a lot. Anything else you want to add here?
So I think one point I would like to add, that sometimes we think that our mental health issues are because we are not resilient, right? A lot of people facing mental illnesses think that I am not resilient enough. That is why this is happening to me. But we also need to realize that there are social determinants of health, and in the same manner there are mental health determinants, right? Which is how your surrounding is. So a lot of time, just like you were talking about students, the life is such that, your brain is not really able to cope up with that stress, because your brain was not meant to cope up with that stress. It has become such now. The run and the rush of life has become such. Like 100 years ago, our ancestors were not doing this. In the last 100 years, there has been such a big shift. So that is what I would like to address, that the social determinants of mental health always. And if anybody ever wants to speak, or they feel like they want to consult somebody, or just want to talk, in India there is a helpline called Telemanas by the government of India. I will I'll send the details to Dr. Mathur. You can write it on your YouTube, and the link as well. And if anyone ever needs any support, please do call this number. It is They have counselors over there in all the languages, and they will definitely support you. So that's
Okay.
all from
All
my
right.
end.
Thank you so much. I mean,
Thank
you
you.
know, I listened and I learned. So I'm happy. I hope others learn too. Let's end this here today. And
Just one
oh,
last thing I want to say
sure.
is thank you to you. Thank you for this opportunity, and thank you for letting me speak for such a long time. A very few people listen to other people speaking for such a long time, and I think it is really a quality that one needs to develop. The patience and the listening skills that you have are really great. I must acknowledge that, and the number of individuals you have heard out and young people that you have heard out, it's really great. And thank you for giving me the opportunity to be one of them. Thanks a lot,
Okay. All
Dr.
right.
Mathur.
Let's end this here.
Okay.
And let's talk a bit afterwards. Okay. So I will be back with another young person or an expert or a young expert soon. Bye, everybody.